A healthy community is a thriving community.
We both come from a background of pharmacy, and we long to have personal relationships with our patients. This gives us the opportunity to do that and then watch them have real results.
We're just here to change the way people engage with pharmacists, the way pharmacies do business. We want to be able to sit down with our patients, discuss their results, and ensure that they have the best outcomes possible. We bring healthcare to the community to ensure that people are getting their health screenings, their questions are being answered, and they're getting life-saving vaccines. That's why MedsPLUS exists. We exist to have that one-on-one interaction with our patients to help them get the real results that they want.
Health is true wealth. At MedsPLUS Consulting, we bridge the gap in healthcare.
All right, we are live.
Hi, everyone.
Hi.
Welcome to today's MedsPLUS Medical Minute, and I am Dr. Jennifer.
And I'm Dr. Pauline.
And today we are concluding our series of GLP-1 medications, understanding the hype, overcoming the fear, and taking control. So today we have a special guest who works with patients every day in this space. Please help me welcome nurse practitioner Yalisha Taylor.
Hi. Hi, everyone. Hey, Dr. Jennifer. Hey, Dr. Pauline.
Hey, welcome to MedsPLUS Medical Minute.
Yes, I'm excited to be here. Thank y'all for having me.
Absolutely. You are welcome. So viewers, let me give you a little background about nurse practitioner Taylor. Yalisha is a board certified family nurse practitioner with over 5 years experience in internal medicine, preventative care, and women's health. She is a proud graduate of Auburn University at Montgomery. She earned her Bachelor of Science in nursing before advancing to her expertise with a master's in nursing from the University of Alabama. Roll Tide.
Roll Tide.
She holds a national certification with the American Academy of Nurse Practitioners and is committed to continuous learning. She is currently pursuing certification through the Institute for Functional Medicine, allowing her to address the root causes of health conditions and more personalized comprehensive care. Beyond her work in healthcare, Yalisha enjoys the simple joys of life, being a devoted fur mom to her Cavapoo Turbo, traveling to new destinations and spending quality time with family and friends. Again, welcome.
Thank you.
So I'm going to start off with how our patients or our viewers who have been listening and following us on this series of GLP-1s, what advice do you have for patients to bring up the GLP-1 conversation with their healthcare provider?
Yes. So a lot of time with the GLPs, if you are trying to use your insurance, they are wanting you to have tried other methods first. Like, hey, doc, I have been exercising. I've changed the way I'm eating. I'm counting my calories, and I'm still not seeing my weight get down to where I want it to be. You know, I'm doing 1,200 calories. I've been in the gym. Most of the insurances are at least wanting at least 6 months of you actively trying. And some of them even want you to have tried another medicine, like a appetite suppressant, like your phentermines, an oral supplement. And I know sometimes some people due to contraindications, blood pressure, heart disease, stroke, or anything like that, you may not be able to do that. So that's why it's important to have that conversation with your doctor, because we have great pharmacists like you guys that compound. And so if we can't get to use insurance, we can always use the compounded semaglutide, tirzepatide if needed. Okay. So that's why it's important that you discuss with your PCP what you've tried, and if your insurance, try to have already called your insurance to check coverage for that to make it easier for your provider.
Yeah, I definitely love that advice to call your insurance. It's a quick phone call for patients. A lot of them think that, the doctor's office should do it or the pharmacy should do it, but your insurance plan knows your specific parameters. So they will know. All you have to do is say, does my insurance, my prescription insurance cover obesity medicine or medication assisted weight loss? And they'll be able to let you know whether medications like these GLP-1s are covered.
Exactly.
That's
And the
great.
number is usually on the back of your card. But if you're tech savvy and you have like the Blue Cross Blue Shield or your insurance plan app, you can find your plan booklet on the app if you don't want to call the representative for your insurance. It's usually in the plan booklet as well.
Absolutely.
Okay, so we talked about GLP-1s being revolutionary. And there's a lot of buzz, social media, and that's one of the reasons why we wanted to dedicate our platform to providing timely, relevant, and accurate medical information to our viewers. So, if you could just share a little bit about how these medications are game changing and so revolutionary.
Yes. And so a lot of times just kind of understanding, they're like, well, they say GLP-1, but basically there's two people say, well, I want to do Ozempic. So yes, Ozempic, that is FDA approved for type 2 diabetes. I always say Wegovy is like the sister drug to or semaglutide. So they're both Wegovy, Ozempic are both semaglutide, but one is FDA approved for like overweight, obesity, and the other one is approved for type 2 diabetes. But it's the same type of drug. The same thing with your Mounjaro. That is a tirzepatide, but the Mounjaro is indicated for type 2 diabetes. And then you have your Zepbound, which is its sister drug. It's still a tirzepatide, but that one is going to be FDA approved for overweight, obesity. The biggest thing about both classes of the drugs, they are effective at controlling appetite, lowering blood sugar, even they are showing that they can reduce the cardiac risk like heart disease, stroke. Wegovy right now has that indication. I'm sure the other GLP will come along soon. I even saw this weekend where chronic kidney disease is actually now being one of the things that, yes, it can reduce, especially for usually patients that have type 2 diabetes. That disease process works on your kidneys. So most of those patients do have kidney disease issues. So yes, it's showing to reduce that. And then we even got the other one, Zepbound, the tirzepatide, showing where sleep apnea. So there is coverage now for sleep apnea patients that are interested. Yes, it's showing to help reduce that. And that makes sense because a lot of times when patients are losing weight, a lot of those things end up going away. And so their reduced is risk. And the risk factors are greatly reduced. So yes, these are great drugs because if they are used the right way with, your exercise and diet changes, you will lose weight. Now, I say it's like anything, it's not a miracle drug. It's just a tool is what I tell patients. You still have to do your part. And a lot of times people say, well, I gain weight after I use these. Yes, if you are not committed to doing the things you need to do with it, the whole purpose of it is to create a healthy lifestyle balance. And so if you are just doing the shot and not doing anything else, once you stop the injection, yes, you will gain the weight back. So you need to create the healthy lifestyle while you're on it. Okay. I kind of call it like a gastric sleeve in a pen form because it's ultimately teaching and training your body. And those little food noises that we get when we're not really hungry, it works great for that.
Yeah, and I love that you're mentioning that it's like a gastric sleeve. So for those of you out there who don't know what a gastric sleeve is, it's a form of weight loss surgery where essentially they drastically reduce the size of your stomach. And for those of our followers who know me personally, you may know that back in 2010, I did have the gastric sleeve surgery. And recently I have been on a GLP-1 medication. So I said that to say it's important to know that for many, many, many people, now there are people who'd like to take the GLP to lose 15, 20 pounds, that kind of thing. But for many people, millions of Americans, obesity is a chronic disease. And with it being a chronic disease, you need treatment just like hypertension, just like diabetes. You may need long-term treatment. So there are some people who will use this for a short time to lose weight, maybe, start a healthy routine. But there are people who may need to be on these medications for their lifetime, just as they would a diabetes medicine or medicine for hypertension.
Exactly. And it hasn't been FDA approved or anything, but I do a lot of women's health with Bella Wellness Center, and a lot of our patients, our PCOS patients, polycystic ovarian syndrome, they have insulin resistance. So these GLP drugs, they do very well. They have not been able to get pregnant. A few months after they start these drugs, their cycles get regulated and they're able to have kids. So fertility, like these are big drugs.
Yeah.
These are big drugs.
Game
And
changer.
one thing I would add, I'm so glad you brought up the PCOS. And then for those women who may not know they're insulin resistant, and we do know of someone who had a surprise and became pregnant. So, and it was a joyous occasion, of course. So yes, I'm glad that you mentioned that. So that's one of the things that you need to know. So if that's what you're planning, that's a tool, and how you can utilize GLP-1s to help that.
Yes, and if you are on the opposite spectrum of that and you are not trying to get pregnant, they do recommend so make sure you, when you're talking to your provider, that that you are on some type of contraceptive or anything, because this will increase your chances of becoming pregnant.
Great, great. So I love also how you describe this as a tool. This is
Yes.
exactly what it is. And you did share some tips for success. So I know you see these patients. Can you share one success story in particular with our viewers?
Yes, I actually had one patient. She had a hysterectomy. Sometimes when we get have those hysterectomies, our hormones change, and you find that you're gaining weight. And she's like, "Hey, I'm doing hot works. I'm doing Pilates. I'm counting calories. I've done appetite suppressants, and the weight is not budging." And with menopause types of things, yes, the weight gain is there, and she was in tears in the clinic. And I said, you know what? I think that I've got something that you will like. You don't have to take it every day. It's just a once a week injection. Let's try to see if we can get this approved with insurance. She came back 1 month and she was like, this is the best drug ever. I've already lost 10 pounds. I have been trying for years and have only lost 5. And within a month, she lost 10 pounds. Because she already had the good eating habits, and I like my patients to try to follow a Mediterranean diet if possible. That gives you just the good balance of your fruits, your vegetables. You're doing more lean meats, your chickens, and you're doing limited beef and things like the red meat on there. But I try to get most of my patients to follow the Mediterranean diet because it gives a good balance of each food category. But I was so happy because she came in, her confidence level, she had on her fitted jeans, and I said, okay. So yes, and so now when she comes in, she's so happy. Most people don't like getting on the scale when they go to the doctor. My patients that are on it, they're doing well and they are ready to get on the scale. And it makes me very happy because my goal is I want my patients just not to lose weight. I want you to the goal is for you to be healthy. We want to decrease these risks for high blood pressure, diabetes, cholesterol. Some people have a family history. And I tell patients, I have some patients that work out daily, eat great, but that family history. So that blood pressure is there, that high cholesterol is there, and they're doing everything they can. And so these GLP-1s are truly life-saving. And yes, Yes, I'm just like, I think more is to come. Every day I'm checking articles to see, hey,
Yes.
what
Mhm.
new disease process is going to improve. But the key is weight loss is helping our patients live longer.
Well, I appreciate you bringing up the struggle for us fellow menopausal women. Yes, it is definitely a game changer with that. You do feel frustrated. So, for my menopause women, if you're frustrated, definitely reach out.
Yes,
Yeah, and so we are so excited to have you here, Yalisha. You have brought a wealth of information to us, and we hope that it's been helpful as we conclude this series for people who have been maybe you've taken a GLP-1 in the past, you had to discontinue because of insurance or whatever the reason, and now you're like, you know what, I'm gaining weight back again, and maybe I need to have another talk with my doctor, or maybe you've been considering it. You've heard about it, you've seen all the commercials and the ads. I mean, we've seen commercials that play every day advertising
exactly.
these GLPs. And so you know that this is a revolutionary drug, and you wanted to see, how can I start this conversation with my healthcare provider? So thank you for providing tips for that. But the
Yes,
key is consistency and healthy habits. If you
yes,
can implement those two things in addition to the GLP, then you are setting yourself up for success. So we'd
yes,
like to say, if you have any questions or you want to see if GLPs are right for you, feel free to reach out to us at MedsPLUS. Our number is scrolling on the bottom. You can call us for a complimentary discovery call. We'll try to answer any questions that you might have. And if you thought that this was helpful, drop a comment below, share this with a friend that you feel may need to see it, and we will love your support in just spreading the news that these medications are out here. And one of our goals at Meds Plus is to always promote health equity, and we want to make sure that everyone who qualifies for this medication has access to it. And that's why we're on here today.
and I'm
So
excited for you guys. Oh, sorry to interrupt you.
no, go
I'm
ahead.
excited that you guys are compounding. So you guys are partnering with us at Birmingham, the Brownstone Clinic downtown. And so the city of Birmingham employees that have, if they can't get approved with their insurance and they want to do a compound, I love that you guys are offering the injections, the compounded injections for them, and the training, like how to do the injections and just the basic steps with eating, things like that, like the wraparound education. It's amazing. We haven't, I think it's been 2 weeks, and I'm
Mhm.
sending everybody y'all's way. I'm like, Dr. Jennifer and Dr. Pauline, they got you covered. They are great. I trust them. So yes, I am so excited for you guys.
Thank you so much. So yeah, we are very excited to be able to offer compounded semaglutide here at Meds Plus Pharmacy and Wellness Center. So if you are interested in starting therapy, if you have questions about it, please don't hesitate to give us a call. Thank you so much, Yalisha, for dropping in and sharing so much
Yes.
knowledge with us. Again, if you have any questions, guys, please put them in the comment or call our pharmacy at 205-650-4636. Just a quick reminder, we're in the month of February. It is Heart Health Month. We want to remind y'all that heart disease is the leading cause of death in the United States, and half of the people who are prescribed heart disease or high blood pressure medications are not taking them properly. So you can see the correlation there. If you're prescribed a medicine and you're not taking it properly, you're more likely to die from heart disease. So we definitely will have more to come on Heart Month and the way to make sure your heart is healthy. And also, I want to say today is my birthday.
Happy
Yay!
birthday.
Thank you. So today is my birthday. Many of you know that I am a twin. So I want to wish a happy birthday to my twin sister Paula. Happy birthday to me. And of course, we're praying for many more years to come. So
Happy
this has been this week's,
birthday.
thank you so much. This has been this week's Meds Plus Medical Minute. It went a little longer than we normally do, but we thank you so much, Alicia, for joining us. And we
Thank
will see
you.
y'all next week.
All right,
Bye,
bye. Thank
everybody.
y'all for having me.
Thank you.